and welcome to Good Life, the health show with me, Pooja. Well, this is a show that focuses on providing you with solutions to your health-related issues, lifestyle, and much more. Well, viewers, hand and foot reconstruction surgery is a very delicate and complex surgical procedure that is performed to restore function and to prevent further deformation. Well, this was what I understood about reconstruction, but to discuss on this elaborately, we have with us Dr. Chandan Nag Choudhury from Ayursundra Superspeciality Hospital. Not to waste any more time, I'll straight away move to him and talk more on the topic which we have taken today. All right, doctor, thank you so much for coming to our show. And it is indeed a privilege to have you in our show because we have taken a topic which is very important these days, and we have to understand in depth what exactly is foot and leg reconstruction. So that is very important. So on first note, what you would like to tell our viewers?
Yeah. The first thing that I want to tell you is that this hand and foot reconstructive surgery, actually it's a new super speciality in evolution.
Okay.
This hand and foot reconstructive surgery, that's mainly concerned with all kinds of surgeries of the hand and foot. The part distal to the hand is considered the part of the hand, and the part distal to the leg is the foot. So we are concentrated only in that part. And you see, hand is a very complex instrument that yet the medical science has not been in a position to fully understand all the functionalities of it.
Right.
And so it's a new super specialization. And it's an amalgamation of 3 different types of surgeries. It involves orthopedic surgery. I'm basically an orthopedic surgeon and trained in hand and foot reconstructive surgery.
Okay.
So orthopedics is the basic. That considers all the bones and the musculoskeletal system that we understand.
So this is your specialty, and we will have a very fruitful discussion on the entire matter, doctor.
Yeah.
Because this is a topic which everyone must not have an idea about it. So this
Yes.
will be a very new thing for our viewers as well, and maybe some might have some idea. So I would like you to elaborately make them understand what exactly, and in their language, that it will be easy for them to understand the
I
matter.
understand. Look, the other 2 specialties that are involved in this is plastic surgery, number 1.
Okay.
Because the hand involves a lot of, we understand that plastic surgery is only about skin, but it's not, it's skin deep, not only. And the other important super speciality that is involved in this is microsurgery.
Microsurgery.
Yeah. Actually, microsurgery is a surgery which is done under a microscope. And here what happens, the small things like the nerves and arteries of the hand, which is barely visible by the human eye, can be seen under a microscope, which gives a magnification, say, around 20-25 times.
Okay.
So it's easier to join them if they are torn. If there is any problem, any pathology in the nerves or the arteries of the hand, so we are in a better position to treat this if we know microsurgery.
Okay, okay. That is very important to know, because you have to understand the things and you have to see through it, because it's
Yes.
very minute.
Exactly.
This is very complicated, actually. We can say that it's a very complicated surgery, and it has to be done in very good hands. And because these are the things people will be very confused to come, because whenever a patient comes to you, you have to make them understand.
Yes.
Because psychologically they will be very disturbed, isn't it,
Yes.
doctor?
Whenever, look, most of the people who come to me are bread earners. And they are laborers, they can be drivers, they can be all sorts of professions.
Right.
But for everyone, the hand is the most important thing.
Very.
Today, if I think my hand does not function in a part, I lose my profession. So that's where, the hand is the most important part of the human body after the brain. And if the brain commands, the hand has to take care of it to deliver.
Okay.
So hand is so important. And you see, for every small thing, today if I pinch a thing and take it out, and if suppose because of some reason a little bit of pain, my hand is not functioning properly and I'm not able to pinch properly, I lose a lot of things. I cannot write, I cannot do anything.
It's
Everything
a very important
involves
role
hand.
it's playing a very
Yes.
important role in our life, exactly. Yeah, so these are the things like one has to keep in their mind. And of course, like if there is a lot of confusion in your mind going on, viewers, then our numbers are flashed on your television screens. And if you have any queries regarding the topic which we have taken today, so you can please call up and ask your questions. The doctor is in our studio to give you all the answers. All right, doctor, coming back to you again. So what can we expect from foot and hand reconstruction?
Yes, as I said, look, it involves a small problem of the hand to the largest problem of the hand.
Okay.
Maybe the largest that I can think of is amputation. Suppose that your hand gets amputated, maybe because of maybe an assault, where someone has, because of an assault, your hand has got chopped off. It is separated from the body.
Maybe while working somewhere.
Maybe in a machine. The machinery injuries are so common these days because you get the hand goes accidentally into the machine and gets cut.
Okay. Doctor, in between, just I have to stop you because we have the first caller of the day. So let's
Okay,
take the
let's
call
take the call.
and then we'll continue with our conversation. Hello? Hello? All right, we have a technical problem out there. So we'll again try to connect to that call.
Yeah.
So we were talking about the amputated limb, and that was my question, because like this is a thing where people will have a shock and people will have a really confusion in their mind that will an amputated hand can be joined again?
Yes. Most of us, when we think, I initially, when it was not known so much that, okay, this kind of surgery is possible, I had patients who had got an amputated hand. And they went to a primary health center or a center which is nearby to them. They were more concerned in saving the life of the patient. So they sent the patient back to a referral center. And when they came to me and I asked them, where is the hand? I can put it back. So they again ran back to the center, got the hand, and then they came back. And I could do the surgery and put the hand back.
Okay.
And today, and I see him, he's working with that same hand, and he comes and sends, sweets to me every Diwali.
It gives you an immense pleasure in actually.
Yes,
like, doctor, we have a caller, so let's take the call. Hello.
Hello, মই ডক্টৰৰ লগত কথা পাতিব বিচাৰিছিলোঁ।
ডক্টৰ শুনি আছে, আপোনাৰ প্ৰশ্নটো কৰিব।
হয়, মোৰ ওয়েটটো লৈ মানে একচুয়ালি মোৰ ওয়েট 65। আজি এমাহমান হৈছে, এজ মোৰ 30, এমাহমান হৈছে আজি। খুব বেছিকে খোজ কাঢ়িলে নহলে বেছিকে অলপ দৌৰাদৌৰি কৰিলে মাসল ক্ৰেম্প অলপ হয়।
ওকে।
তো হেইটোৰ কাৰণে মই কি কৰিব পাৰো?
Actually, যদি আপনি if she has started running maybe very recently.
You can reply to her in Assamese.
Okay. Actually, যদি এনেকে হয় যে আপনি ধৰক বহুদিন এনেকে ইমান খোজ কাঢ়া নাই বা ইমান দৌৰাদৌৰি কৰা নাই, আর হঠাৎকে আপনি একদম দৌৰাদৌৰি কৰা স্টার্ট করে দিয়ে, তেতিয়া কি হয়, এই আমার বডি অ্যাডজাস্ট করতে টাইম লয়। The first reaction the body gives is in the form of muscle spasm. So this muscle spasm যেখিনি ডেভেলপ করে, তেতিয়া আমার গোটেই মাসলসখিনি স্টিফ হয়ে যায়, but it gets relieved with medication and maybe some rest and all. So what I would like to advise you is that go slow, take time, let the body get adjusted to it. I think that's the best way.
All right, so I'm sure the viewer who have just asked the question must be benefited with what doctor has really mentioned right now. So doctor, we were talking and we were having a conversation on the amputated limbs which can be or cannot be. So what is your thought on that?
But through these discussions, I always want to stress upon a thing. These amputations that happen, suppose a hand has been amputated. Most of the time we don't know that whether it can be put back. Then the next important question comes, where to take the patient? Who is capable enough of doing it? And another more important thing is that the time. The time is the most vital thing in this kind of surgery. You see, an amputated part which is separated from the body can survive without blood supply maybe for 6 hours.
Okay.
But if we really bring the patient and bring back that amputated part in a way in which we can increase this time. So it is very important that the patient has to reach that particular center where this kind of surgery is done and in time. 6 hours is the critical time.
Time is very important.
Yes, maybe it can be extended to 10 hours if the part is cooled and brought.
Okay.
So it is important that we all know that suppose we see a patient who has got an amputation.
All right, let's stop you in between, doctor, because we have another caller, so we'll continue that. Hello.
Hello.
Yes.
Yes.
I'm मैंने मैं डॉक्टर साहब बात करना चाहता हूँ।
जी डॉक्टर
हेलो।
सुन रहे हैं, आप अपना टीवी
हाँ।
का वॉल्यूम थोड़ा कमा लीजिए तो हम आपका क्वेश्चन अच्छे से सुन सकेंगे।
हाँ बोलिए, क्या प्रॉब्लम है आपको?
मैंने जो एक किसका मैंने किया एक्साइटेड होता है, मेरे पैनिक मैंने माइंड एक्साइटेड होता है कि मैंने लड़की देखने बाद और ये कभी थोड़ा के बाद मैंने कि पेनिस जो किया सेमेन था वो मैंने आउट हो गया।
हम आपका बात नहीं समझे।
All
Can you
right,
could you get it?
আপুনি অসমীয়াটো প্ৰশ্ন আমাক সুধিব পাৰে, তো আপুনি অসমীয়া যদি কমফৰ্টেবল আপোনাৰ প্ৰশ্নটো হেতুত কৰিব।
When I see excited thing or girls or thing or mind any mind, and then the semen is out directly.
All right, this is something related to his mind, which is like, okay, we are having a discussion on some other topic, but we will try to sort out your problem as well.
Yes.
So maybe he was relating something to excitement or something related to that.
Yeah,
so
maybe,
what
yeah.
is your suggestion on that? Maybe he'll have to go to see
Yeah, he should
another
consult a
specialist.
specialist. Yes.
Okay, so
Yeah.
which specialist you would like to tell?
Look, if it's something with the mind and he's having some anxiety and fear, so I think the best person to go to is a psychologist
Okay,
or
okay.
a psychiatrist.
Okay, let's continue with our conversation, doctor. So
Yeah.
the first thing is that everyone will have a confusion in their mind that where to take the patient.
Exactly.
That is the first thing which comes in our mind. And everyone thinks that everything is possible or the better treatment is possible outside. So
Yeah.
what is your notion on that?
Look, today knowledge is everywhere. We have knowledge in our fingertips. So I don't think so. In all spheres of life, you see, we are not laid back. We have all the facilities, the infrastructure, and the manpower maybe to really compete with any other part of the country or maybe the outside world. So these kind of facilities are still available in Guwahati, and we in Ayursundra Superspeciality Hospital, we are trying to promote that yes, for this kind of super speciality surgeries and reconstructive surgeries, we are the center where we are really pitching up for these kind of operations where
All right.
like these kind of amputations can be
Okay,
reimplanted
so
back.
things are like working out and technical latches of the things are very upgraded. So
Yes.
we'll have a caller. So let's take the
Yeah,
call.
let's take it.
Hello.
হেল্ল' মোৰ শ্লিপ ডিস্কটো আছে, শ্লিপ ডিস্ক মাজে মাজে প্ৰায় হেল্ল'
Hi,
আমি
Kak.
শুনি আছো।
আমি শুনি আছো, Kak.
শ্লিপ ডিস্কৰ মোৰ প্ৰব্লেম হৈ আছে আজি প্ৰায় 40 বছৰ হৈ গ'ল। এইটো
Okay.
ঘপককে হৈ যায়, হয়তো চিৰি দি ওপৰত উঠি আছো নামি আছো,
হয়।
হৈ যায়। ভলিউম দে।
আজি আপনি কোনো এতিয়ালৈকে কোনো ডক্টৰক দেখাইছে নেকি আপনি?
নাই মই একো দেখুৱা নাই, কাৰণ মই মেডিকেলৰে মানুহ মই।
Okay.
তো মই দেখিছো এইটো চিভিয়াৰ হৈ যায়, কেতিয়াবা মানে শুব নোৱাৰো, কোনোবা শুৱাই দিব লাগে, উঠিব লাগে, আকৌ ঘপককে উইদিন ঠিক হৈ যায় এইটো। সেইকাৰণে মই এইটো কনচাল্ট কৰা নাই কাকো আজিলৈকে। আজি ফাৰ্ষ্ট আপোনাৰ লগতে কনচাল্ট কৰি আছো।
কিন্তু আপনার
কিন্তু
যদি এইটো
কিবা-
40 বছর ধরে হয়ে আছে, মই ভাবো আপনার কোনোবা ডক্টরক দেখাব লাগে। ইটস এ সিরিয়াস প্রবলেম। আর মই ভাবো আপনি কোনোবা ডক্টরক দেখাই এমআরআই কৰাব লাগে আপনার।
কিবা চান্স আছে নেকি এইটো?
হয়,
পার্মানেন্ট চান্স আছে নেকি কিবা?
নিশ্চয় চান্স আছে। স্লিপ ডিস্ক ইজ 100% কিউরেবল। আর আজিকালি স্লিপ ডিস্কৰ কাৰণে আমি মাইক্রো লাম্বার ডিস্কেক্টমি কৰোঁ। মাইক্রোস্কোপিক্যালি ডিস্কটো রিমুভ করা হয়, যেটো ইজ এন এক্সেলেন্ট সার্জারি অ্যান্ড দ্য গোল্ড স্ট্যান্ডার্ড ফর ডিস্কস। তো তার কাৰণে আপোনাৰ এজন ডক্টৰক দেখাব লাগিব, আপোনাৰ এমআরআই কৰাব লাগিব, বা আপনি আহি আমাক দেখাব পাৰে।
Okay, so it's better that he has to go immediately
Yes, he
and
should.
have his
But
diagnosis
he's
done.
Continuing with the disease for last 40 years.
Yeah, so it's a long time.
Yes.
Okay, so doctor, we have another caller, so let's take
Yeah.
the call. Hello.
মই ডক্টৰৰ কথা পাতিব বিচাৰিছো।
হয়, কওক।
তাৰমানে মোৰ গোটেই গাটো অনবৰতে পুৰণি ধৰি থাকে, কেলে হয় বাৰু?
আপোনাৰ বয়স কিমান হ'ল?
মোৰ বয়স 48 প্লাছ।
48 প্লাছ।
হয়।
চাওক, আপুনি যেটো কৈ আছে সেইটো আপোনাৰ ফাৰ্ষ্ট হ'ল যিখিনি প্ৰব্লেম আপোনাৰ হৈ আছে সেইখিনি আপোনাৰ এজন ডক্টৰক দেখাব লাগে, মেবি এ গাইনেকলজিষ্ট অৰ এ মেডিচিন ডক্টৰ। তাৰ কাৰণে এই আপোনাৰ যেটো পুৰণি আৰু যেটো তেহেঁতে ক'লে সেইটো কি হয়, বহুত কাৰণৰ কাৰণে হ'ব পাৰে। Maybe there is some neurological problem, maybe there is no problem, but she is in the menopausal age, maybe that may be a factor. So maybe she should consult a gynecologist, and I think that would help her.
Okay, I'm sure the viewer who have just asked the
Yeah.
question must be benefited. Okay, doctor, we have
Sure.
another caller waiting. Hello? Hello? Hello?
Hello.
আপোনাৰ প্ৰশ্নটো কৰিব আমি শুনি আছো।
Hello.
Hi, Kok.
Hello.
Hello?
Hello, sir. মই অবিনাশ তালুকদাৰে কৈছোঁ।
Hi, Kok. Mr. Avinash.
sir, আপোনাৰ মই পেচেণ্ট হয়। মই এম্বুলেশ্যন আপুনি কৰিছে। বহুত ডাঙৰ মানে মই এটা ৰিকভাৰী হৈছোঁ। তাৰ পৰা মই এইটো কাৰণে ফিডবেকটোৰ কাৰণে মই আপোনাক ফোন কৰিলোঁ। আপোনাৰ তাত মই বহুত ভাল ছাৰ্ভিচ পাইছোঁ। প্লাছ মই আজি নিজৰ এটা ৰাইট লেগ এম্পুটেশ্যন হৈছে, তথাপি মই এইটো ফিল নহয় ইমান ধুনীয়া চাৰ্জাৰী প্লাছ ইমান ধুনীয়া ছাকচেছফুলি মানে মোৰ আজি মানে মই চলিব পাৰিছোঁ। মই ৰবটিক্স লেগ জানে আপোনাৰ লগত কনচাল্ট কৰিছিলোঁ গোটেইখিনি বস্তু কৰিবলৈ।
Yes.
ত' মই বহুত হেপ্পী মোৰ লাইফটোক লৈ যি হৈছে আৰু এইটো হৈ গ'ল। থেংকছ ফৰ আপোনাৰ গোটেই মোৰ আজি এইটোৰ হেৰিত আপুনিয়ে জব আছে আৰু।
Okay. Thank you so much. Thank you, Avinash.
All right, so those are little and such wonderful words.
Yes.
And when you get such callers and such patients like
Yeah,
who
this
are
is,
like benefited, so it gives you an immense pleasure and it feels that you have
it
done
feels
your
good,
job.
when a patient like this, very few people talk good.
Yeah.
Maybe when it comes to medicine, very few people talk good about doctors. But Avinash, he had an amputation. He had a road traffic accident.
Okay.
And his one leg got amputated and the other. So we had treated him for maybe over a period of months, many surgeries, many things. And today he is back on his legs and he is walking, and it's all because of this reconstructive surgery.
Okay.
And that's why the call is.
So things have updated so much, like everyone and everything
Yes.
is possible. So doctor, we have a caller waiting, so let's take the call.
Okay.
Hello?
হেল্ল'
আপোনাৰ প্ৰশ্নটো কৰিব আমি শুনি আছো।
মোৰ এটা কমপ্লেইন আছিলে।
Hello?
Hello.
প্ৰব্লেমটো কি কওক।
মোৰ মাজতে চিৰচিছ হোৱা বুলি ক'লে ডক্টৰে। ট্ৰিটমেণ্ট কৰিলোঁ, বৰ্তমান অ'কে বুলি ক'লে লিভাৰ, কিন্তু মোৰ ভোকটো অহা নাই, একদম ভালকৈ মন নাযায়।
ওকে, আপোনাৰ প্ৰশ্নটো আৰু এবাৰ ভালকে কৰিব, আমি ভালকে শুনিব পৰা নাই। আপোনাৰ প্ৰশ্নটো কি আছিলে?
মোৰ চিৰচিছ হৈছিলে বুলি কৈছিলে
Liver
ডক্টৰে।
cirrhosis.
Okay, যদি আপোনাৰ লিভাৰ চিৰচিছ আছে তো মই ভাবোঁ আপোনাৰ এজন গেষ্ট্ৰ'এন্ট্ৰলজিষ্টক দেখাব লাগে। আৰু গেষ্ট্ৰ'এন্ট্ৰলজিষ্টক দেখালে আপুনি ভাল পাব। আপনি আয়ুৰসুন্দ্ৰা সুপাৰ স্পেশালিটি হস্পিটেলত আমাৰ গেষ্ট্ৰ'এন্ট্ৰলজি বেলেগ ডিপাৰ্টমেণ্ট আছে, তাতে আপুনি আহি দেখাব পাৰে।
All right, doctor, we have another caller waiting, so let's take
Yeah.
the call. Hello?
Hello.
Hello? Hello?
Hello.
আমি শুনি আছো, আপোনাৰ প্ৰশ্নটো কি আছিলে?
Hello.
হেল্ল'?
হয় বাইদেউ।
আপোনাৰ প্ৰশ্নটো কি আছিলে কৰিব?
মোৰ এই আঙুলি ভৰিৰ হাড়দিকেইটা আঙুলিখিনি অলপ বিষায়। ডক্টৰ দেখুৱাইছোঁ।
ঠিক আছে, মই বুজি পাইছোঁ আপোনাৰ ভৰিৰ আঙুলিকেইটা অলপ বিষায়। তো সেইটো আৰু বেলেগ বহুত কাৰণৰ কাৰণে হ'ব পাৰে, যেনেকৈ আৰ্থৰাইটিছৰ কাৰণে হ'ব পাৰে। তো মই আপোনাক এনে চাই পেলাই তো আৰু খালি এটা কথা শুনি পেলাই আমি আপোনাক চিকিৎসা দিব নোৱাৰিম, কিন্তু আপোনাৰ ইনভেষ্টিগেশ্যন কৰিব লাগে। তাৰপিছতে কিহৰ কাৰণে হৈছে সেইটো ওলাব লাগিব, তাৰপিছতেহে আপোনাৰ ট্ৰিটমেণ্টখিনি ষ্টাৰ্ট কৰিব পৰা যাব। তো মই ভাবোঁ আপোনাৰ এজন অৰ্থপেডিক চাৰ্জন বা আপোনাৰ ওচৰতে যিজন আছে বা আমাৰ ইয়াতে আহিব পাৰে, আপোনাক মেইনলি মেডিকেল হেল্প কৰা দৰকাৰ।
Okay, thank you so much for calling. So it's better always to have a proper diagnosis so
Yes.
that things will be clear and then treatment can be started on time, isn't
Yes,
it, doctor?
exactly.
Because like hearing the things, it's very hard and it's very difficult to judge and it's very difficult to tell the treatment, isn't it?
Exactly. Yeah, just from one sentence you cannot make out. There can be hundreds of causes because of pain in the leg. So, you really need to investigate, you need to find out what's the causes, and then you can go ahead with the treatment
And
part.
proper time of treatment is also very important because you
Yes.
have to do the treatment on time.
Exactly. Many patients who come now, actually they go through their own personal treatment first. And they with all home remedies they go through, and they go to the quacks, and then when everything fails, then only they come to seek real medical help.
Actually, this is actually what the society is all about. Like they all do the treatment, and nowadays internet has helped a lot.
Oh, yeah.
So they do a lot
That's
of
a
research,
menace.
and they again come up with the doctors, and maybe you must have also got a volley of questions from the patients as well.
Exactly. Today, internet, since knowledge is there everywhere. So many patients come up, and a few days back I had a patient who read the internet so thoroughly and said, look, I have this problem. And
so we'll talk on that, doctor. Like, what confusion do you get, and how do you clear those confusion to the patient? But we have a caller waiting, so let's take the call.
Okay.
Hello.
মই ডক্টৰৰ কথা পাতিব বিচাৰিছো
কওক
তাৰমানে কি মোৰ মিষ্টাৰ লিভাৰ চিৰচিছ হৈছিলে তাৰপতে এতিয়া মানে ডক্টৰে অলপ কিয়ৰ হৈ বুলি কোৱা বুলি কৈছে কিন্তু ভাতটো খাবলৈ একেবাৰে ইচ্ছা নকৰে অন্য খায় কিন্তু ভাতটো খাবলৈ
একচুয়ালি এটো আপনার কোয়েশ্চনৰ আনসার লিভাৰৰ ডক্টৰ গেস্ট্ৰোএন্টাৰলজিস্টে হে আনসার কৰিব পাৰিব আমি আপোনাক আনসার কৰাৰ ইয়েত নাই এখানে আপনি এজন গেস্ট্ৰোএন্টাৰলজিস্টক কোয়েশ্চনটো সুধিলে বেটার হ'ব নেকি
But just if you would like to give a suggestion that what
it's
would
very
be
difficult
that,
to give in cross speciality.
But in general, if we can talk that it's a very important that everyone has to change their lifestyle, isn't
yes,
it?
Yes,
lifestyle has also played an important role with our health.
Absolutely. So lifestyle is important.
Lifestyle is important, proper diet is important, and proper
Yes.
timing of diet is also important.
Yes.
So doctor, we were talking about like different confusions when people come to you and they do a lot of research and then they come to you with a volley of questions.
Yes, many a times when a patient comes, they read the internet and they come and they say, okay, all the medicines that are prescribed, maybe sometimes they buy them over the counter, try them and everything, and they suppose that in the net they find out there's a small procedure which is written that okay, this can be done if this does not work. The patient comes and says, look, I want to do this procedure. Then I tell them, okay, look, I am not here only to do the procedure. It's not a technical issue. First thing is that I need to see the patient, I need to diagnose, and I'll have to make the diagnosis myself.
Absolutely.
The internet is, sometimes it's a menace. And many patients, when you give them some advice, they go through the net. Now, previously people used to take a second opinion. That was better. Because
sometimes, it gives you a fruitful like queries of answers also, but sometimes it becomes like more knowledgeable things, which is very difficult to understand whether it is true or not.
Exactly, because there are patients who exactly don't know the diagnosis, but they write, okay, like a patient who has called us before.
All right.
He called us and said that he has a slip disc. He's also already made up his mind that I have a slip disc.
Okay.
And he may, and such a patient, if goes to the net, there's hundreds of treatment. Now the basic question comes is, really he has a slip disc or not? That only the doctor can say.
Diagnosis has to be done.
Yes.
Then only things will be more clear. Doctor, we have a caller waiting. Let's take the call. Hello.
hello
আপোনাৰ প্ৰশ্নটো কৰিব
মোৰ প্ৰশ্নটো মানে মেডাম মোৰ এনেকুৱা হয় ভৰিবিলাক জিনজিনাই চিৰামুৰে ধৰা খুব পুৰণি হয়
হয়
মই এনেই ধৰক মেডিচিন ডক্টৰৰ ওচৰত ডিব্ৰুগড়তো দেখাইছোঁ আৰু যোৰহাটতো দেখাইছোঁ মই এতিয়া কোৰ্চ কৰি আছোঁ কিন্তু আজি দুমাহে মই একো ভাল পোৱা নাই অকণ
মই বুজি পাইছোঁ আপোনাৰ ভৰিটো জিনজিনাই আছে আৰু আপুনি দুমাহ ধৰি ডক্টৰক দেখাই আছে আপুনি ভাল পোৱা নাই মই ভাবোঁ আপোনাক কোনোবা হায়াৰ চেণ্টাৰক দেখাব লাগে যিটো আপোনাৰ ঘৰৰ ওচৰত হয় কাৰণ কি আপোনাৰ এই জিনজিনানিৰ বহুত কাৰণ হ'ব পাৰে মেবি স্লিপ ডিস্ক হ'ব পাৰে মেবি নাৰ্ভৰ কোনো প্ৰব্লেম হ'ব পাৰে ডায়েবেটিছৰ কাৰণে হ'ব পাৰে বহুত কাৰণ থাকিব পাৰে সেইকাৰণে মই ভাবোঁ ফাৰ্ষ্ট আপোনাৰ যিকোনো এজন ডক্টৰ এনে হায়াৰ চেণ্টাৰ দেখাব লাগে আপোনাৰ ইনভেষ্টিগেট কৰিব লাগে আপোনাৰ MRI কৰাব লাগে টু ফাইণ্ড আউট দ্য ষ্টেটাছ অফ দ্য নাৰ্ভ দেন অনলি সাম ট্ৰিটমেণ্ট ষ্টাৰ্টছ treatment just from a phone call is difficult.
All right. So treatment just for a phone call. Actually, it is difficult, but the things which are basics and the thing which is this person is facing the problem. So what could be the reason of shivering of leg? As you have mentioned, maybe slip disc.
Yeah, slip disc is one. Then there can be inherent problems in the nerves. Okay, maybe because of diabetes, he has neuropathy. There can be other compartment syndromes in the nerves. Okay, these are nerve compressive neuropathies. Many a times this falls in our hand and foot surgery, then many a times you see the tinglings that come in the hand and the jinjinai thake boli sabe koi. So that is basically the nerves are involved and the nerves get entrapped. In these kind of surgeries, microsurgery plays a very important role and it's really curative at that time.
And sometimes people in their day-to-day life also feels a numbness of their leg or numbness of their hands, maybe because of overloaded of work or what could be the reason?
Maybe, but you know, many a times in diabetes, what happens, the patient's foot and the lower limbs become numb. There's a tingling and numbness, and slowly they don't feel anything. That's because of the compression in the nerves.
Okay.
And this can be treated with microsurgery, and we can release the nerve, and I have patients to prove that, you know, a sensation that is completely lost in a diabetic foot can return really back.
All right, doctor, we have a caller waiting, so let's take the call. Hello? Hello? Hello?
I think.
All right, we got that call
lost
disconnected,
connection.
so
Yes.
let's wait for another call. So, doctor, we were talking about little basic things also, like we were talking about the numbness of the leg, numbness of the hand, and which is maybe or may not be possible because of the whatever the physical activity we are doing day to day in our day-to-day life, isn't it?
Yeah, there are many other problems that, you know, because of the nerves. And
Related to nerve.
Nerves, yes. There can be compartment syndromes, that as I told you. There can be, you know, a carpal tunnel. There's a tunnel here where the nerve gets entrapped. And many a times, you know, when medicine treatment fails, and surgery gives an excellent results in those cases where there's tingling and numbness in the hand.
All right, doctor, we are again connected to that caller, so let's take the call. Hello?
Hello?
Apunar prashno to koribo?
হয় মোৰ প্ৰশ্নটো হৈছে মানে মোৰ আঁঠুটোত কিবা এটা শব্দ ওলাই থাকে মানে
Okay.
হেল্ল'
আমি শুনি
হয়
আছো।
মানে মোৰ আঁঠুটোত কিবা এটা শব্দ ওলাই থাকে মানে
আপোনাৰ আঁঠুটোত শব্দ ওলাই?
তেনেকুৱা নিবিষায় হয় মানে আঁঠুটো কোচালে শব্দটো ওলাই যায়
Okay.
কিবা এটা চাউণ্ড এটা ওলাই যায় মানে আঁঠুটোত
হা.
আৰু ধৰ উঠা বহা কৰিলে অলপমান অসুবিধা হয় কেতিয়াবা
Okay.
আৰু
So,
ঠাণ্ডা
বহুতবাৰ
দিনত মানে
এনেকে
আঁঠুটো
হয়,
অলপ-
বহুতৰ এনেকে ইয়ে হয় যে আমাৰ যেনেকে জইণ্ট মুভ কৰিলে শব্দ ওলায়, যেনেকে আমি বহুতে এনেকে আঙুলি এনেকে ইয়ে কৰি শব্দ ওলাব পাৰে। It's the same. This is basically displacement of nitrogen, যাৰ কাৰণে এনেকে আৱাজ ওলায়। আৰু ইয়েও হ'ব পাৰে যে কোনো এটা পেথলজি থাকিব পাৰে। মই ভাবোঁ আপোনাৰ এখন ফাৰ্ষ্ট ইনিচিয়েল এটা এক্সৰে কৰাই চাব লাগে, কোনোবা ডক্টৰক দেখাব লাগে, তাৰপিছতহে কিবা পেথলজি আছে না নাই সেইখিনি ওলাব লাগে।
All right, the caller is on the line. If you want to ask more question, since when he's facing this problem.
Hello?
Apuni ei problem to kitiar para face kori ase?
এই
কিমান দিন?
প্ৰব্লেমটো মোটামুটি মোৰ 2 বছৰমান হৈ গ'ল কিন্তু তেনেকুৱা বিষ নহয় কিন্তু ঠাণ্ডাৰ দিনত অলপমান আঁঠুটো ফুলে মানে ভিতৰত কিবা গধুৰ যেন অনুভৱ হয় অলপমান
হয়, যদি আপোনাৰ তেনেকে the problem that he said is that you know, during cold he has swelling.
He's listening to you, so you can reply to him.
He তেহেঁতৰ যদি এনেকে ভৰিটো ফুলি আহে বা swelling হয়, so it can be a form of arthritis, so which I think is treatable and 100% curable also. So I think he should take expert opinion regarding what is exactly the problem and should go ahead with the treatment.
All right, so better treatment can be done, but
Yes.
before you have to do a proper diagnosis on that, and then things will be more clear, and then treatment can be started on time, isn't
Exactly,
it?
yes.
So, doctor, we'll have more discussion. Maybe we'll have more phone calls and more queries. But on that note, we'll have to slip into a short break. So, viewers will have to slip into a short break, but do come back soon because we have lots more on the other side. Welcome back, viewers. You're still watching Good Life, the health show with me, Pooja. All right, doctor, coming back to you again. We were talking about the very important thing, amputation. And we also got a caller who was thanking you for a better treatment, and he got a successful treatment on it. So, doctor, if anyone sees such kind of patient in any this kind of condition, so how can that patient be transported to the hospital?
Yeah.
So is there any kind of like a...
Yes, that's very important. You see, when you see a patient who has got an amputation, there are two important things that you should know. Where, if you see a patient, where to take it and as early as possible.
Right.
Okay, so how to transport that patient? Suppose he has an amputation of the hand. So what you should do, that part which has been amputated, you have to put that part in a plastic bag.
Okay.
And fill it with normal water.
Normal water.
If normal saline is not available, you take tap water, seal it, and then put that part again in another plastic which contains ice.
Okay.
So if you give ice in that part and the part is cooled, So what happens, this time that we are talking about is 6 hours, so it can be extended up to 10 hours.
Okay.
So in that case, what happens, a patient who had an amputation and reaches the hospital and the surgery has to start immediately. What more important is that the patient has to inform us beforehand so as to keep everything ready.
Right.
Because time is precious here.
Absolutely.
So when the patient gives us a call that, okay, patient is coming, and we get information from our network that we are getting a patient who has an amputation, we keep the whole system ready.
Whole system ready.
And the patient, a few cases, in last year we had done a case of an amputation,
Okay.
who had come within 1 hour. Another doctor, he went to another doctor. The doctor called me up saying that I'm sending a patient who has completely amputation. He cooled the part, he put it in ice and sent back the patient. The patient came in maybe around 2 or 3 hours after the incident, and we took him up for surgery within 15 minutes.
Okay.
And maybe after around 7 to 8 hours of surgery, and he has a full-fledged,
So
completely
that is a
functional
very
hand
important
today.
knowledge everybody should have in their mind. That
Yes.
if any kind or any such kind of conditioned patient you see in front of you, so what are the things, what are the basic things one
Yes.
has to do, isn't it,
Yes.
doctor? So other than that, what are the other things one has to keep in their mind?
What I think is that, look, the part which is amputated, it will bleed.
What is the span of time you have to do these things in? What a span of time? Is there a
Look,
span?
the blood, without the blood, it can survive only for 6 hours, cooled, then it's around 10 hours.
Okay.
But after that, the part starts dying, and the surgery cannot be done after 10 hours.
Because you can never know that what kind of condition do you find in which place, and you will find an
Exactly.
ice, you will find a water.
Yeah.
So that needs a bit of time.
Yes, but you see, I've seen patients, like, people are innovative these days. You know? When I tell ice, they could not get ice, many patients. So what they do? They get cold drink bottles from the nearby shops. It's cold. And they just put cold drink bottles around and they bring it back.
Okay.
And the part that has been amputated will bleed. So the only way you can stop bleeding is just compress it with
Compress it with-
compressor.
Okay.
Okay, you should not, many people apply different kinds of leaves, many people apply we should not be doing that.
Okay.
Okay, what you should do, if bandage is not available, you can use any kind of cloth.
clean cloth if you
Yes,
find yours.
and just press it. And press it. All bleeding will stop if you keep it pressed.
Okay.
And maybe if you keep it pressed for some time, the bleeding automatically stops. And then you just stop the bleeding and try to get the patient to the next health center possible. And if you think a reimplantation, this surgery is called reimplantation.
Reimplantation.
Yes, that means it's a part that is completely amputated, you have to put it back.
Okay.
So you can really do it, but you have to, that's what I'm saying, the drawbacks are that the patient does not reach in time.
Absolutely. Okay, doctor, we have a caller waiting, so let's
Okay.
take the call. Hello.
হেল্ল'
আপোনাৰ প্ৰশ্নটো কৰিব?
মোৰ মানে গলটো শুকাই যায়, মানে অলপ ভয় ভয় ভাৱ লাগে।
Okay.
হেল্ল'
আমি শুনি আছো, কৈ থাকক।
মানে মোৰ অলপ গলটো শুকাই যায় আৰু ভয় ভয় ভাৱ হয় মনত।
Okay.
Okay.
এটা সমাধান।
মই ভাবো তেহেঁতৰ কিবা ভাইৰেল ইনফেকশ্যন বা
Okay.
ভাইৰেল কমন কোল্ড তেনেকৈ কিবা এটা হৈ আছে নেকি। And I still think that he should see a medicine doctor. But normally আমি যেটো gargling কৰোঁ আর যেখিনি আমার home remedies, these also gives you good relief. Maybe you can take some menthol and all and do gargling. And if then he doesn't recover, he should go and consult a doctor.
Okay, absolutely. So, doctor, we have another caller waiting for us, so let's
Okay.
take the call. Hello. Hello.
হেল্ল'
Hi, Kak.
প্ৰশ্নটো কৰিব?
আচ্ছা মোৰ মিছেছৰ মানে আপোনাৰ এই শ্লিপ ডিছৰ প্ৰব্লেম অলপ।
কিহৰ problem?
Slip disc.
Slip disc. Okay. আপনার যেটো স্লিপ ডিস্কৰ প্ৰবলেম কিমান দিনৰ পৰা হৈ আছে?
এইটো এনে বহুত দিনে হৈছে, আপোনাৰ এতিয়া আৰম্ভণি হৈছিলে মোটামুটি 2 বছৰমান হৈ গ'ল।
আর ভৰিত জিনজিনাই থাকে নেকি?
অলপ অলপ জিনজিনাই।
অলপ অলপ জিনজিনাই থাকে। আর যদি সেইখিনি আপনি কোনো পৰীক্ষা কৰি চাইছে নেকি বা কোনোবা ডক্টৰক দেখাইছে নেকি?
মই মানে কি জেনাৰেল এমআৰআই এটা কৰিছিলোঁ।
হয়।
ঘৰতে মানে শ্লিপ ডিছৰ প্ৰব্লেম বুলি কৈছে।
ওকে, তো ডক্টৰে কি এডভাইস কৰিলে আপোনাক?
এডভাইচ কৰিলে যে আপুনি হয়তো হেৰি কৰিব লাগে, মেডিচিন অলপ দিলে, মেডিচিন খাব দিলে, সেইখিনি খাওঁতে কমিলে।
হা।
আকৌতো হৈছে।
Okay. তো মই ভাবোঁ নৰ্মেলি যিখিনি মাইল্ড ফৰ্ম অফ শ্লিপ ডিস্ক হয় সেইটো কাৰণে এনেকেই ট্ৰিটমেণ্ট কৰা হয় যে ইনিচিয়েলি মেডিচিন দি ট্ৰিট কৰা হয় we try to treat the patient conservatively with medicine, rest, and there are plenty of other things. Physiotherapy also plays a big important role. But এইখিনি কৰাৰ পিছতো যদি আপোনাৰ ভাল নহয় then I think you should consult again. I think you should consult in the same place and then they are in a better position to tell you if you have not recovered ইমান দিনতে যদি এইখিনি কৰি recovery হোৱা নাই তো next what is the line of treatment.
All right. So
Yeah.
this will be more convenient, like if you have a proper diagnosis and if it is not
Yes.
giving you a fruitful treatment,
Yes.
so you can again have a proper diagnosis and then again
No, I think the
treatment can be-
diagnosis is fine, but you see there is no treatment modality which is 100% guaranteed.
Absolutely.
So what happens, suppose every problem you have to treat first conservatively with medicines and all. And if does not work, then you go, the second option is that of for a surgery. So as for a slip disc, you can go ahead with a surgery, but it is only done when conservative treatment fails.
All right. So doctor, let's come back to our topic.
Yes.
Hand and foot
Foot
reconstruction.
reconstructive surgery.
So if we talk about the hand reconstruction, so what would you like to talk on that? Hand surgery, that is a very important thing which you
Yeah.
have been doing. So what kind of number of patients do you see every day on this kind of problem which comes to you?
Yes, look, I think maybe I'm the only one who is doing only hand surgery.
Okay.
So, and when the most of the patients that I see has already been treated in different other centers, and maybe they have not achieved the amount of result that we can get.
Okay.
Maybe suppose that a finger has been completely amputated. Of this, the thumb is the most important. You see, the thumb is the most important part of the human body after the brain, which has led to all developments, the thumb. And that constitute around more than 70% function of the hand. So if a thumb gets amputated and cannot be reimplanted and whatsoever, all the story is there.
Right.
But if it has been amputated and he does not have a thumb now, so what can be done? There are many options. We can convert one finger into the thumb,
Okay.
and we can transplant this finger and make it function like a thumb. So what happens? The patient regains almost 70 to 80% function of the thumb, and the hand becomes really functional.
Okay.
Because if you imagine a hand without a thumb, almost 30% function can only be done.
Okay.
But with this kind of surgery, this is called reconstructive surgery. You reconstruct.
Reconstruct.
Okay, so I'm reconstructing. Here, if we have 4 fingers, and out of these 4 fingers, if one is absent, doesn't make a big difference. But if the thumb
But
is
thumb
not
is the
there,
most
it's a major difference.
Okay.
So what we do? We transport one of these fingers in the place of the thumb.
Okay.
So this is reconstructive surgery. You know, whatever you have, you try to reconstruct that.
in that.
Yeah, so that you can give maximum function to the patient.
Absolutely. Okay.
So
So,
these
what
things
is the
are there.
first thing, like, I would just like you the procedure
Yeah.
to tell our viewers, like, what is the procedure of your hospital or what is the procedure of yours when a patient comes to you? What is the first thing you do to them? Do you sit with them, talk about their background, take about their histories,
Yeah.
and you have to talk about the high pressure, diabetes, that is very important,
That's
which is
okay,
seen
yes.
in every patient these days.
Yes. You see, that kind of the first initial the assessment that you do is always that has to be done first.
Okay.
Then when you come to that specific part of the problem, so suppose there is a hand problem. Most of the problem, you see, many patients get operated, but just because they don't get good physiotherapy, they don't do exercise properly in a structured manner, they develop stiffness.
Okay.
And you know, they start saying, okay, the treatment was not done right, and there's. But only thing is that these reconstructive surgery here in Ayursundra, we have a comprehensive backup where all the surgery, the physiotherapy, the rehabilitation, everything is taken care of in under one roof.
Okay.
So what happens? Even if I do an excellent surgery and the patient does not come for follow-up, does not go for physiotherapy, the recovery is not appropriate. So it's a teamwork.
It's a teamwork.
So it's the complete team that is important. And this teamwork always leads to better results.
Right. Everyone has to do their part very
Yes,
carefully.
yes. And maybe I may be the team leader, but the rest of my team is very important. You see, physiotherapy plays a very important role in gaining function of the patient.
Okay.
So function is what ultimately is most important. If you had a fracture and the fracture is healed, but doesn't make sense if the patient does not move his fingers
Okay.
and really cannot hold objects and has difficulty in moving and holding objects, then the whole purpose of this surgery is gone.
Okay.
So it's the function which is important. So in hand surgery, it is most important is that how do we regain function. So function is, it's a completely teamwork, as I said.
Okay.
And exercises, physiotherapy, timely exercises, physiotherapy, and the patient has to be under follow-up till he recovers full function.
All right, doctor, we have also learned that nowadays equipments, technologies have upgraded so much.
Yes, yes.
So where can people find all the facilities in one roof, which we say? Because like people wants convenience every time, isn't it?
Yeah. Look, there are many, if I shunt the patient from here to another hospital, look, this facility is not available, you go to another hospital. It's bad for the experience for the patient and for everyone. So, you know, in Ayursundra, we have been stressing on comprehensive treatment under one roof.
Okay.
Right from the diagnosis to the investigations to the surgery and then the rehabilitation, the physiotherapy has to be done in one place. The patient has to see all these steps and go through all these steps under one place. Now, if I tell them that, okay, go and see that that physiotherapist in a different place, it becomes difficult for the patient.
All right.
And when the physiotherapist is working under my supervision, I know my patient is doing this and this is his recovery, I can guide him, okay, please don't do this or do this more. So what happens under one roof is a big issue.
And proper guidance and proper treatment is important, but proper guidance is also very important.
Yes, very
because side by side, like medicines work, a proper guidance is also very important for everyone,
yes,
isn't it?
yes.
So reconstruction, hand and foot. So there are other things like if we talk about plastic surgery, doctor,
Yeah.
people have a notion about plastic surgery, which can we opt that?
Yes.
So what is your take on that?
Look, in hand, most of the things are plastic surgery. When it does not come to injury, other things that, if you delete amputation, the other things that come, because amputation is only once or twice that you get a case like this.
Okay.
But what happens, most of the patient comes with all the tendons may be injured, the skin is injured, there are multiple cuts.
Right.
And these can be joined back with plastic surgery.
Okay.
In the plastic surgery, you can transport skin, you can transport bones, you can transport tendons from one place to another. Maybe we can transport even the nerves. Suppose the nerve is cut and there is a loss of a particular segment of the nerve. With microsurgery, this is possible today that you can take out a nerve from another place and transport it back and make it function like before.
Okay.
So this is that with the advent of microsurgery, you see the switches that we use, this is medical technology has developed so much. The switches that I use while doing a microsurgery, if I keep it in your hand, you will not be able to see it with your naked eye.
Right.
It's only with microsurgery that it is possible. So with the technology has played a big role in development.
And one has to know the terms and conditions of everything, like because
Yeah,
that
yeah.
plays an important role.
Very important
because like you will find out the minute to minute things and then treatment can be started on time,
Yes.
isn't it? So plastic surgery, this is a term like everyone has a notion in our like society.
Yeah.
This is something like very like a very term, which is a very heavy term. So is it a heavy term or can be used in
Look, plastic surgery,
yeah.
anything which involves reconstruction of the skin and improving the cosmetic appearance, we call it a plastic surgery.
Yeah.
So like a hand which has lost its skin, we can do plastic surgery, we can take out skin from one part of the body and transport it back here.
Okay.
And put it back and let it function like before. So this is plastic surgery. Now the plastic surgery, we are concentrated only in hand and foot.
Right.
But plastic surgery involves a lot of things. There is a lot of cosmetology is going on and people are getting their facelifts and all. Those are also plastic surgery. But that is maybe another subspecialty which I'm not involved. I'm involved
Okay.
with mainly with the skin
Okay.
and the foot.
But it's under one roof, so you
Yeah.
can always give a consultation to the other
Yes.
patients as well. So
Yeah, that's
if it is
okay.
not of your genre also, but it can be consulted to the patients
True.
to go here and there. Okay, doctor, talking about the recovery part, how long does a patient needs the time? What is the time span of recovery?
Look, that's a very vast topic on how much time. A patient who has a simple fracture in the hand, maybe the fractures heal by a month or and a half.
Okay.
And maybe then you start with physiotherapy, maybe in another month or so, he develops, with good exercises, he develops most of the functions of the hand. But nowadays, our aim is that we fix the bone on the first day and start the physiotherapy and all immediately, the next day of the surgery.
Okay.
So the recovery gets down, the time for the recovery goes down. And maybe nowadays everyone is so busy, and you don't have time to spend 2 months for maybe a simple fracture of the hand. So what happens? You fix the bone, start exercises, so you don't let the stiffness come in.
All right, so the treatment has become very accessible for
Yes,
these days.
yes.
Yeah.
And you have to really customize your treatment according to the needs of the patient.
Absolutely.
Because a patient maybe who is maybe a writer, a painter, or anyone who is a physical laborer, for them a hand is most important.
Right.
So you have to give it its own importance. And you see, everything is, so your treatment has to be customized according to the needs of the patient.
Okay.
So as you understand, the people who are in showbiz, for them, looks are so important. And maybe for my patients, I'm not concerned much how the hand looks until and unless it should be functional. So function is important for me.
Absolutely. Okay, so function is very important, and I'm sure the viewer who are just watching our show must be having a beneficial, because like the fruitful discussion which we are having today is very important to our viewers to know that what things are to be done and what things are not to be done. Or doctor, in our day-to-day life, there are so many things like which happens with us. Like talking about the basic things, the sleeping position of a person. Like if you do not sleep in a good position, you might have a pain in your neck, you might have your pain in your back. So these are some of the things, some of the basic things. So what are the tips you would like to tell our viewers, like if you have a pain in your neck due to a very bad position of sleeping or any bad position of sitting, so what are the things you should keep in your minds? Just a basic idea to our viewers there.
Okay, look, there are many things which we don't follow, and maybe we follow sometimes, that we have always learned that hard bed and low pillow is the best. We all, there are many persons who has a backache for maybe any reason, and the moment they have a backache, they start sleeping on a hard bed. But what I think, hard bed and low pillow is exactly not true.
Okay.
What is important is the way you have been sleeping for the whole of your life. I think that is the best position for you sleep.
Because you have been habituated with that.
Yes, your body is accustomed to it.
Right.
Now suppose that you were sleeping on a soft bed with a big pillow for years together. Your body is habituated to that. Now just because one day you had a backache doesn't mean that you change your bed and you start sleeping on a hard bed. That will worsen your condition.
Okay.
So you have to find out what is the cause of the pain, treat the cause of the pain, and not that you just change your bed. Many people I have seen, they come and tell me, okay, I have been sleeping with a big pillow, but one day my doctor said, okay, I have spondylitis, and then I started without a pillow. I said, that's worse, and my pain has never gone away.
Okay.
So maybe spondylitis maybe is not 100% curable, but this is not the way to treat spondylitis. So what you said, sleeping position is important. There is no fixed rule what is the best sleeping position.
Okay.
But what I would like to say is that the position that you are accustomed to, I think that is the best position.
Okay, so that is the best position, and I'm sure these are the basic things, these are the little things everyone has to face in their day-to-day life, like sitting position, while you're working in your workplace, how you're sitting for hours and hours, but you have to get up in the between and you just take a walk. That might give you a
that is
freestyle
very
activity
important
as well.
question that you said. Nowadays, you see, most of us, we are using computers, maybe laptops for long hours, 8 hours, 10 hours. But what's happening to our back when you were sitting in one position for long hours? And we don't know exactly what is the right position to sit.
Okay.
So it is very important for all those in IT sector and other people who are using computers for long hours. It is very important to know that the best position to sit. The best position, what I think, is that you should always sit on a chair which is supported in your back.
Okay.
Okay. You should not be, normally what happens, whenever they are doing a serious job, we try to bend forward and try to do this. But if you were doing this in one position for long hours, it becomes difficult for your back to handle it really. You have to sit always supported.
Okay.
You have to see that your spine is straight as far as possible.
Okay.
You have to see that the monitor should be at the level of your eyes. You should not be looking down, you should not be looking up. That put a lot of stress on your this cervical spine muscles.
Okay.
Next, what happens is that when you're using a laptop is not meant to be used for long hours. If you have to use long hours, you have to use a desktop.
Right.
So you see, if you're using a desktop, then your shoulders and your elbow should always be supported. Because if you're holding a mouse and you're holding at a higher level, with this position, if you are working for long hours, maybe for 4 or 5 hours, if I'm using the mouse like this, with the shoulder up and the elbow up, so I'm going to have pain.
So between little breaks has to be given to your body to get it accessible and to get it rest, and then you can proceed with your work, what you have been doing for hours and hours, isn't it?
Yes.
So in between, like when we say that we should take little meals to have a full and a good tummy, so it's just like that we should always have a little break in between, and then we continue with our work, isn't it, doctor?
Yes.
So we are about to end our show, doctor. It's just like we have to wrap up the show. We are short of time. So what are the last things and what are the final tips you want to tell our viewers?
Finally, that I want to say is that this hand and foot reconstructive surgery that we are practicing now is a boon for all those people who has injuries in their hand and foot, maybe with road traffic accidents becoming so common today. So we are in a position that we can really refix an amputated part if brought within time. We have done so many cases in Ayursundra where we have put back a hand which was completely amputated, and the caller who gave us a call just now saying that he's so happy. So when you see a patient coming back and who has an injury, for me it's the profession of the patient which is most important. There was an accountant who came to me with just a thumb injury and he could not write, so lost his profession. So we did a reconstruction of the thumb and he could write. So he's so happy that he comes and says me that you have given me back my meals every day. So that is the way. So reconstructive surgery is a boon for all those people. It encompasses all those kind of injuries from minor, a small cut in the hand with a tendon injury, with a nerve injury, to the maximum, that's an amputation.
All right, so successful stories always gives a pleasure to the doctors, and it gives you moral boost so that you can perform your duties more well. And thank you so much, doctor, for coming to our show and giving us such a fruitful understanding and a fruitful discussion we had on the basic topic. And I'm sure the viewer who have just watched our show must be benefited with what we had discussed today. And with this, we have come to the end of the show, and we hope that we were able to answer all your queries in the best possible way. And in our next episode, we will be discussing on some other important health issues. So if you have any queries, do join us next Sunday at 8 p.m. live. Till then, stay healthy, stay fit, and keep watching Northeast Live. Goodbye.